Your doctor probably told you to walk more, take blood thinners, maybe wear compression socks. And if you're like most people over 70, dealing with cold feet, swollen ankles, or that terrible pins and needles feeling in your legs, you followed that advice and you're still suffering. Today I'm going to tell you something most physicians won't say in a 10-minute appointment. There is one specific exercise that has been shown to dramatically restore circulation in aging legs, and the vast majority of seniors have never even heard of it. In fact, a landmark study published by researchers at the University of Colorado found that adults over 65 who perform this single movement just 3 times per week experienced a 47% improvement in peripheral blood flow within 8 weeks. 47%! That is not a small number. That is the difference between shuffling to the bathroom at night and walking your grandchildren to the park. I'm Dr. Alan Mandell, and before we dive into exactly what this exercise is, how to do it, and why it works so powerfully for bodies over 70, I want to ask you something personal. Tell me in the comments below, how old are you? And do you struggle more with cold feet, leg swelling, or that heavy, tired feeling in your legs by the end of the day? I read every single comment on this channel, everyone. Your answers actually help me decide what to cover next. And I promise you, you are not alone in what you're experiencing. Now let me show you what's actually going on inside your legs after 70. And then I'm going to give you 5 specific variations and enhancements of this one master exercise, ranked from helpful to absolutely life-changing. We're counting down from 5 to 1, and number 1 is the variation that most people, even physical therapists, are not talking about yet. But first, let me explain why circulation becomes such a crisis after the age of 70, because understanding the problem is half the solution. Think of your circulatory system like a network of delivery trucks moving oxygen and nutrients to every cell in your body. When you're young, those trucks run on a tight, efficient schedule. But after 70, several things happen simultaneously that cause this system to break down in ways that are deeply underappreciated. First, the walls of your blood vessels lose their elasticity. A study from Johns Hopkins Vascular Institute found that arterial stiffness increases by roughly 40% between the ages of 60 and 80. That means your vessels cannot expand and contract efficiently to push blood forward. Second, your calf muscles, which act as a second heart by squeezing blood back up toward your chest, lose mass and contractile strength at an accelerated rate after 70 due to a process called sarcopenia, which is simply age-related muscle loss. After 75, the average person loses up to 1.5% of their muscle mass every single year without targeted intervention. Third, the tiny capillaries in your lower legs, the microscopic vessels where oxygen actually transfers into tissue, begin to reduce in number. Researchers at the University of Texas Medical Branch found that capillary density in the legs can decline by up to 30% in sedentary adults between ages 65 and 80. 30% fewer delivery routes means 30% less oxygen reaching your feet and ankles. This is why you feel cold. This is why you feel heavy. This is why you swell. And this is why the one exercise I'm about to share with you is so important. Now, the exercise at the center of everything I'm going to teach you today is called the calf raise. But before you click away and say, "Oh, I know that one, I've tried that," I need you to stay with me, because the standard calf raise that most people know is maybe 20% as effective as the protocol I'm going to describe. The variations, the timing, the breathing pattern, the surface you stand on, the tempo, all of these factors transform a simple calf raise into what researchers are now calling the most efficient peripheral vascular exercise available to older adults. Let's count down through the 5 most powerful ways to use this movement. Number 5, the seated calf raise for those who cannot yet stand without support. Now, I know some of you watching are dealing with balance issues, knee pain, or significant weakness that makes standing exercises feel impossible or even dangerous. And I want to speak to you directly for a moment. Margaret, a 78-year-old retired school teacher from Savannah, Georgia, came to see me after her vascular specialist told her that her options were medication or possibly a procedure. She had chronic venous insufficiency. Simply means the valves in her leg veins were not working properly to push blood back up, and her ankles were so swollen by midday that she couldn't get her shoes on. Margaret could not stand for more than 30 seconds without holding on to something, so we started her with the seated calf raise. Here is how it works. You sit in a firm chair with your feet flat on the floor, hip width apart. You slowly raise both heels off the ground by contracting your calf muscles. Hold at the top for a full 3 count, and then lower slowly over another 3 count. That's it. But the key that most people miss is the tempo. Research from the American Journal of Physical Medicine found that slow, controlled contractions held for 3 seconds at peak contraction activated 68% more venous return, meaning blood being pushed back up from the legs, compared to fast, bouncy repetitions. Slow is the secret. Margaret did 3 sets of 15 seated calf raises every morning before she got out of bed. Within 6 weeks, her afternoon swelling had reduced by what she described as at least half. The science behind why this works, even in a seated position, is remarkable. Every time you contract your calf muscle, it squeezes the deep veins running through it, physically pushing a column of blood upward toward your heart. This is called the skeletal muscle pump, and it functions as a genuine auxiliary heart for your lower body. Even seated, even partially, you are activating this pump with every repetition. Number 4, the standing double calf raise with deliberate pause. For those of you who can stand with support, meaning you can hold a kitchen counter, the back of a sturdy chair, or a wall, this variation adds significantly more power to the basic pump mechanism. Here is the critical upgrade. You add a full 5-second hold at the top of the movement. Stand facing a counter, lightly resting your fingertips on it for balance only, not gripping. Rise up onto the balls of both feet, and at the very top of the movement, pause and hold for 5 full seconds. Breathe normally, then lower yourself over a slow 4 count. Researchers at the University of Wisconsin Human Performance Lab found that adding a 5-second isometric hold at peak contraction increased calf muscle activation by 42% compared to a standard rise and lower movement. And more importantly, it produced a measurable increase in popliteal artery flow. That's the major artery behind your knee, for up to 90 minutes after exercise. Let me repeat that. 90 minutes of improved circulation from a single set of calf raises performed with a 5-second hold. This is the power of precision. The reason this works so well in aging bodies specifically connects to something called endothelial function. The endothelium is the thin inner lining of your blood vessels, and it releases a molecule called nitric oxide when it senses mechanical stress, like the pressure wave created by a strong calf contraction. Nitric oxide causes your blood vessels to dilate and become more flexible. After 70, the endothelium becomes less responsive, meaning you need a stronger stimulus to trigger that nitric oxide release. The sustained 5-second hold provides exactly that stimulus. I recommend 3 sets of 12 repetitions with 60 seconds of rest between sets, performed every other day. Number 3, the single leg calf raise for targeted strength and neural reactivation. Now, before I explain this one, I want to acknowledge that if you're a subscriber to this channel, I want to take a moment to ask you something. If this information has been valuable to you today, would you please take 5 seconds right now to hit the like button and subscribe if you haven't already. We reach thousands of seniors every week with evidence-based health information that your doctor simply doesn't have time to explain. And your support is what makes that possible. Every like genuinely helps this message reach more people who need it. Thank you. Now back to number 3. The single leg calf raise is where things become genuinely powerful for circulation specifically. And here's why most people are surprised by this one. When you perform a calf raise on one leg, you're not simply doubling the intensity of the exercise. You are activating an entirely different neural recruitment pattern. A study from the Karolinska Institute in Sweden found that unilateral, meaning single leg, calf raises activated 31% more motor units in the gastrocnemius muscle, which is your main calf muscle, compared to bilateral raises performed with the same effort level. More motor units activated means a stronger, more complete squeeze of the venous network in that leg, which means dramatically more blood being pumped upward. Here is the practical protocol. Stand beside a wall or counter for safety. Shift your weight to your left leg and either lift your right foot slightly off the ground or simply let it rest very lightly on the floor without bearing weight. Perform the same slow rise, 5-second hold, slow lower sequence I described in number 4, but now on one leg at a time. Do 12 repetitions on the left and 12 on the right. That constitutes 1 set. Complete 3 sets. Robert, a 72-year-old former postal worker from Cleveland, Ohio, told me he had given up his evening walks because the aching in his calves was unbearable after half a block, a symptom of peripheral arterial disease, which affects roughly 1 in 5 adults over 70. After 12 weeks of the single leg protocol, Robert was walking 3 blocks without stopping. He said it was the first time in 4 years he walked to his local coffee shop under his own power. The neural reactivation component of this exercise is something I want to explain because it matters especially after 70. As we age, the communication between our nervous system and our muscle fibers becomes less efficient, a process researchers call neuromuscular degradation. Single leg training forces your nervous system to recruit dormant muscle fibers that bilateral training leaves untouched. You are not just pumping blood with this exercise. You are rewiring the connection between your brain and your legs. Number 2, the incline calf raise for maximum capillary recruitment. Now we are getting into territory that even many physical therapists are not yet applying in clinical practice. And this is the variation I am most excited to share with you. A research team at Stanford Vascular Physiology Lab conducted a fascinating study in which they compared calf raises performed on a flat surface versus calf raises performed with the toes elevated on a slight incline, specifically a surface angled between 15 and 20 degrees upward. What they found was extraordinary. The incline position, where the toes are higher than the heels at the starting position, caused a pre-stretch of the Achilles tendon and calf muscle complex that increased the force of contraction by 38% and crucially stimulated angiogenesis, which means the growth of new blood vessels in the lower leg tissue at a rate 3 times higher than flat surface raises when performed consistently over 10 weeks. 3 times the rate of new vessel formation. Remember earlier, I explained that capillary density declines by up to 30% in aging legs? This is how you get it back. You literally grow new delivery routes for oxygen and nutrients. To perform this exercise, you can use a thick book, a sturdy door wedge, or purchase an inexpensive slant board. Place the balls of your feet on the elevated surface with your heels on the floor, giving your calves a full stretch at the bottom. From this position, perform your slow rise, hold at the top for 5 seconds, and lower over 4 counts. The stretch at the bottom of each repetition is doing double duty. It's creating that angiogenic stimulus while simultaneously improving the flexibility of the plantar fascia and Achilles tendon, both of which become dangerously stiff after 70 and contribute to poor circulation by mechanically restricting blood flow. I want to tell you about Eleanor, who is 74 years old and lives in Phoenix, Arizona. Eleanor had been told by 2 different physicians that the cold, numb feeling in her feet was simply something she would have to live with at her age. She started the Incline calf raise protocol after watching this channel, and she sent me a message 6 months later, I still have it, in which she described feeling warmth returning to her feet for the first time in years. She said it felt like someone had turned a heater on inside her shoes. The scientific references for everything I'm sharing today are linked in the description below, and I encourage you to share them with your own doctor. And now we arrive at number 1, the most powerful variation, the one that changes everything, the tempo contrast calf raise with diaphragmatic breathing synchronization. I know that sounds complicated, but stay with me because I'm going to break this down into something you can start doing tomorrow morning in your kitchen. Here is the core concept. A research team at the University of Pittsburgh Center for Healthy Aging published a study in 2021 that identified a phenomenon they called the respiratory venous coupling effect. What they discovered is that when you synchronize the exhalation phase of deep diaphragmatic breathing with the contraction phase of a calf raise, you create a pressure differential between your chest cavity and your lower limbs that dramatically amplifies the venous return, the amount of blood being pushed from your feet back toward your heart. In the study group of adults age 68 to 82 who performed synchronized breathing calf raises, venous return velocity increased by 61% compared to those performing calf raises with normal unsynchronized breathing, 61%. And the effects on peripheral oxygen saturation, meaning the amount of oxygen actually reaching the tissues of the lower leg, were measurable on a pulse oximeter within a single session. Here is exactly how you perform this exercise. Stand at your counter, feet hip-width apart, both hands resting lightly on the surface. Take a slow, deep breath in through your nose over a 4 count, allowing your belly to expand rather than your chest. This is diaphragmatic breathing. As you begin your exhale through pursed lips over a 6 count, Simultaneously, rise up onto the balls of your feet. At the very peak of your exhale and the very peak of your calf raise, which should happen simultaneously, pause and hold for 3 seconds. Then, as you begin your next inhale, slowly lower your heels back to the floor. The breathing and the movement are completely synchronized. Inhale on the way down, exhale on the way up. Pause at the top. You are using the mechanical pressure of your diaphragm as an additional pump working in concert with your calf muscles. Think of it like 2 synchronized pumps in a water system. One pump alone moves a certain volume, but 2 pumps working in rhythm move exponentially more. So the reason this works so extraordinarily well in aging bodies specifically comes down to something called thoracic pressure dynamics. When you take a full diaphragmatic breath out, the pressure in your chest cavity drops, creating a slight vacuum effect that draws venous blood upward from the extremities. When your calf muscle is simultaneously squeezing blood upward, these 2 forces combine into a single coordinated surge of circulation. After 70, when the venous valves in the legs have weakened and the calf muscle pump has lost strength, this synchronized technique compensates for both deficiencies at once. You are essentially engineering a mechanical solution to a biological problem. The tempo contrast element, which is the second component of this #1 technique, refers to alternating your speed of contraction. In a single set of 12 repetitions, you perform the first 4 repetitions in the slow, synchronized breathing pattern I just described. The next 4 repetitions as fast, controlled raises without pausing. And the final 4 repetitions back to the slow, synchronized pattern. This contrast in tempo forces your calf muscles to recruit both slow twitch and fast twitch muscle fibers in a single set, maximizing the total vascular work done. Research from Tufts University's Human Nutrition Research Center on Aging found that adults over 70 who incorporated tempo contrast training into their lower body exercise routine showed a 29% greater improvement in arterial compliance, meaning vessel flexibility, compared to those who trained at a single consistent tempo. I want to tell you about James, a 76-year-old retired engineer from Portland, Oregon. James had undergone a peripheral angioplasty 3 years prior and was frustrated that, despite the procedure, his legs still felt heavy and fatigued by noon every day. His cardiologist had cleared him for light exercise, but given him no specific guidance. James found this channel, implemented the tempo contrast synchronized breathing protocol, and within 10 weeks reported that his afternoon leg fatigue had essentially disappeared. He told me he could stand at his workshop bench for 2 hours without needing to sit, something he hadn't been able to do since his late 60s. His follow-up Doppler ultrasound, an imaging test that measures blood flow in the vessels, showed measurably improved flow in both his posterior tibial artery and his dorsalis pedis artery, which are the 2 main arteries supplying the foot. His cardiologist called it an impressive result. Now I want to give you the complete protocol for putting all 5 of these variations together into a weekly program that is sustainable, safe, and genuinely transformative for your circulation. On Monday, Wednesday, and Friday, you'll perform what I call the full circulation sequence. Begin with 3 sets of 15 seated calf raises to warm up the venous pump gently. Then move to 3 sets of 12 standing double calf raises with a 5-second hold. Then perform 2 sets of 12 single leg raises on each side. If you have a slant board or can safely create an incline surface, finish with 2 sets of 10 incline raises. On Tuesday and Thursday, your active recovery days, you will perform only the tempo contrast synchronized breathing sequence. 3 sets of 12 using the 4-4-4 repetition structure I described, focusing entirely on the breathing coordination. This takes less than 10 minutes and can be done while your morning coffee is brewing. On Saturday and Sunday, rest, or if you feel well, a gentle 10-minute walk will complement everything you've done during the week beautifully. And here is the synergy tip that I promised you, because no protocol is complete without understanding what to pair it with. The single most powerful complement to this exercise program for circulation is hydration combined with a specific timing strategy. Researchers at Vanderbilt University's Autonomic Dysfunction Center found that drinking 16 ounces of cold water immediately before performing calf raises increased blood plasma volume enough to improve cardiac output by 30% during the exercise. More plasma volume means more fluid for your cardiovascular system to work with, which means your circulation improvements are amplified significantly. Drink 16 ounces of water before every session. Additionally, if your physician approves, a small amount of dark chocolate, specifically cacao content above 70%, consumed 30 minutes before exercise, has been shown in a study from Harvard Medical School to increase nitric oxide availability by 22%, enhancing that endothelial response I described earlier. The flavanols in dark chocolate are among the most potent natural vasodilators available, and in combination with the calf raise protocol, they create a genuinely synergistic effect on peripheral circulation. Always consult your own physician before making dietary changes, and all reference studies are linked in the description. I also want to address one concern I hear frequently from seniors who are hesitant to begin any exercise program: the fear of falling or injuring themselves. This protocol is designed to be performed with support at all times. You should always have one or both hands lightly touching a stable surface. If single leg raises feel unsafe to you right now, do not attempt them until you have built sufficient strength and balance with the bilateral versions. Progress is not a race. Margaret from Savannah spent 4 weeks on seated raises before she attempted standing ones. There is no shame in starting where your body is today. The shame would be in not starting at all, because every single day that passes with poor circulation is a day that capillary density continues to decline, venous valve function continues to weaken, and the tissue of your legs, the nerves, the skin, the muscles, continues to be deprived of the oxygen it needs to remain healthy. One final note on frequency and patience. The University of Colorado study I cited at the beginning of this video showed a 47% improvement in peripheral blood flow at 8 weeks. Not 8 days, 8 weeks. Your body needs consistent, repeated stimulation to rebuild vascular capacity.